Locala is a social enterprise, and what that means is all of our colleagues have a share in our organisation and therefore have a say in how we run our organisation and how we change the way we deliver services. And that's really important to make sure people feel a part of it and that they can change how we delivered and we can really work together in a different way. We try to make sure that's part of everything we do. We try to make sure it's threaded through into our values, and we try to make sure that the outcome of that is we provide better for the people who use our services and for their families together. It also means that we invest back into our local communities by working with local community groups like the Brownies, where we invest in some programmes that they're doing or projects that they're doing that changes the life of local people within our catchment area.
Being caring for us is about providing the best possible care for our patients. We manage minor illness and urgent care, so anyone with a minor illness or urgent care problem. Every patient's an individual. We need to make sure that we give them that care. Trying to provide that care, we try and make sure that patient goes away happy. We do get lots of positive feedback from our patients. Lots of people saying that, you know, we are doing a good job, and to me, if the patients are saying that they're happy and that the care is good, then we must be doing something right. The team as a whole, I think we provide a really good shared environment, really, and we work with each other and work together to improve the patient care on a daily basis, where you know that you've done the best for that patient. That makes the difference, and that patient goes away knowing that they've had the best care that they possibly can.
My name's Julie Maguire, I'm a district nurse at Locala. I work with a team of nurses and healthcare assistants, and we deliver nursing care to housebound patients in the community. So those patients may be in their own home or in a residential home, and the team also run a clinic as well, so we can do dressings, injections and other nursing interventions for patients who are able to come to a clinic, so those who are not housebound, who may be working and need a clinic time. I think the best thing about working in Locala is it is a community organisation. It's purely focused on delivering care in the community, and we are encouraged to work together within a multidisciplinary team to provide the best care for patients.
So my name's Claire. I'm one of the team leaders in the Public Health Intelligence Leads for the 0 to 19 service. So as part of that role, we work across communities to understand what the health needs are and identify those health needs. So we work with communities, but we look at sort of wider determinants as well. And then we look at ways of sort of working together to meet those health needs, because we know that health and well-being are key to achieving positive outcomes in life. So an example of that might be looking at sort of breastfeeding and things like that. So in terms of breastfeeding, we work with other agencies like Midwifery or Anti-PAMS, which is a local initiative to deliver those outcomes. A part of my role is sort of working within wider community hubs, but there's different groups of people within that, and there's different specialities within that. So it's about really understanding what is right for people and keeping us not only as individual clients and families, but those sort of communities at the heart of what we're doing. In terms of why I like working for Locala, I really like Locala's ethos and its values, and I really identify with them on a personal level and on a professional sort of work ethic level. So that's why I really like working for Locala, because there's a lot of transferable sort of values there, and I really feel valued within the organisation. I feel like there's opportunity there to sort of follow work streams and opportunities to develop.
My name is Diane McKerricker. I'm the chair of Locala Community Partnerships, and my role is to run an effective board, which means that we have to ensure that we have the right mix of members on board and that we make the correct decisions for Locala in behalf of its service users. So it's about getting closer to the real needs of individuals and making sure that that's all part of what we do when we shape our strategy when we talk about our values, when we talk about what's important, that we know it's come from our service users, from the heart of what we're here to do, rather than just from the board and the senior management team.